possibly even being prevented. And that's really important with our population makeup here. I just read with the CDC that's the most common cause of cancer in Hispanic women. So how could you detect this early? I mean, what can they do?
Well, you know, the standard recommendation is that women start getting mammograms at the appropriate age and actually get yearly physical exams starting at a very young age. It depends on who you read, and the federal recommendations have changed slightly, but generally starting either at 40 or sometimes a little bit after that, you need to start getting mammograms fairly regularly. And if you have a family history of breast cancer, then you need to start getting mammograms much earlier than that. Generally, they recommend starting to get mammograms about 10 years before the youngest person in your family was diagnosed with breast cancer. Now, in addition to mammograms, other things can be done. The radiologist or the person doing the mammograms can recommend an ultrasound, and less commonly, certain people might even get MRIs. But the whole goal behind this and the regular exams is to find lesions in the breast early. When you find these early, they can hopefully be caught before it actually turns into invasive cancer and cured before that.
What effect do you think the new national health care plan will have on getting some of these tests done? Do you see any changes? Will women still be able to get these tests done as easily as they can now?
You know, there's so much that's not known about the new national health care program. It's hard to tell. On the one hand, they do say that there'll be more funding for this kind of preventive measure, so it may be. On the other hand, it may be more difficult for people to get tests that aren't on a strict protocol. So hard to tell exactly what, you know, as it plays out, we'll know.
Okay. I guess maybe how long does it take for this to form? Is it something that you have days to figure out, weeks, months, years? What's the time period we're talking about?
In general, if you notice a new mass in your breast, it needs to be evaluated by a physician. You need to go to your family doctor or your OB/GYN and tell them about this mass. And of course, if you have a mammogram done and the mammographer recommends a biopsy or a repeat mammogram, which they'll tell you when the report is done, you shouldn't wait on this. It's not that anything's going to happen within a day, but obviously if you wait on it longer and if it happens to be an aggressive tumor, then you might need more aggressive treatment the longer you wait.
And Angelina Jolie's double mastectomy definitely brought up the fact that this is an important issue.
It is. You know, and in her issue, she had some genetic testing done. So that brings up another issue. Can it be predicted with 100% accuracy with a genetic test? And it unfortunately cannot. You know, but there certainly are some families who have a gene that really predispose the ladies and perhaps even the men to breast cancer and certain other kinds of cancers. So if that's present in the family, then it's important for each young lady to get that genetic test done so that they can find out if they have the gene, and then ideally get some procedures done that may prevent them from developing these cancers.
Okay. Well, thank you very much, Dr. Vijay, as always. Now, if you have a question for the doctor, email it to us at news@KIIITV.com or